Yes, madam. Let me introduce, please. Dear participants, very good evening. Welcome to the next session. Today we have with us distinguished academician and professor working in Anna University in Department of Biomedical Engineering. She has illustrious career in both academics as well as in research. She is basically completed BE Electronics and Communication from the University of Madras in the year 1996, and then she did medical electronics from Anna University, and she did a PhD in medical image processing from Anna University. She has a very varied interest and contributed in terms of publications as well as patent, and she has done many projects. Specifically, she did two patents she has filed with respect to the imaging device for monitoring bacterial growth, antibiotic screening, and force measurement system for a surgical procedure. And she has published papers in very reputed journals, and she has guided many research scholars, and she has completed many projects funded by DST, DBT, etc. So we are very fortunate to have you with us, madam. Thank you. Over to you, madam. Thank you.
Thank you so much, sir. I hope the slides are visible.
Yes, madam. It's visible, madam.
Okay, it's very good to see many participants in this late hour also. So today I'll be presenting on AI-driven strategies for effective ADHD management, innovations and insights. So we know ADHD is attention deficit hyperactivity disorder, and mostly it is found in children, and detecting ADHD at an early stage is very important. And the symptoms that we generally find out in these conditions are, from the name itself, from the acronym itself, it is attention deficit. That means these children will be inattentive as well as impulsive, react immediately, and hyperactive and disorganization. They cannot carry out any activity in an organized manner. So there will be disorganization, forgetfulness, they'll be restless, and emotional dysregulation. Okay, they'll not be emotionally stable, and difficulty following through. If they take a task, it will be very difficult for them to carry out the entire task and complete it. So if you see why ADHD is very important here is, if you see over the years, the percentage of prevalence of these disorders is increasing. So if you see generally the neurodevelopmental disorders in Indian children, it is found to be 12%, aged between 2 to 9 years. So when I say neurodevelopmental disorders, autism spectrum disorder, ADHD, as well as specific learning disabilities comes under neurodevelopmental disorders. So year by year, this percentage keeps on increasing. So it needs a lot of attention, because at the young age, if we are able to provide some solution to these children, they will lead a quality life. And if you see the types of ADHD, they say that there are 3 types of ADHD. Inattentive is one group, hyperactive, and combined type. Combination of both inattentive and hyperactive. So if you see in percentage wise, hyperactivity, 34.1 percentage of the population of ADHD is found to be hyperactive, and 9.8% is inattentive, and around 56% is the combination type. So mostly you will see only the combined type. And also the children may not have only ADHD, even combination of ADHD and ASD is possible. So children with ASD, they may have symptoms of ADHD, or the other way, the children with ADHD will also have some amount of ASD spectrum also. So slightly I will touch upon the fundamentals before going into the case studies of how ADHD can be detected using machine learning and deep learning algorithms, as well as how ADHD can be managed, or how therapeutic treatment can be provided using neurofeedback. So before that, I just wanted to touch upon the fundamentals to understand better. So we all know the different lobes in the brain, as well as its functions. So we have the frontal lobe, which is associated with alertness and mental activities. We have the temporal lobe, which is associated with auditory functions, and occipital lobe is associated with vision, and parietal lobe, it is associated with the somatosensory cortex, as well as somatosensory regions. So, whenever we design some methods or algorithms, we should be very careful in placing the electrodes, at what locations we are going to place the electrodes, and based upon that only your entire methodology and the results will be based upon from where you are acquiring the signal, from which locations you are going to acquire the signal. They have compared, in the literature, they have compared both the normal brain as well as the ADHD brain, and here the different lobes have been shown here. And the left one is a normal brain, and the right one is a ADHD brain. And it is found that in ADHD there will be a reduced volume of brain. If you take the same age group of child, uh, when compared to a normal child and ADHD child, there is found to be a reduction in the brain volume. As well as here you can see some yellow regions in the parietal lobe, as well as in the frontal lobe for a normal person. So this indicates the functional connectivity. So there will be functional connectivity between different lobes. So here the functional connectivity is shown in both in the parietal and the frontal region. Whereas in the ADHD, this functional connectivity in the frontal region is missing. That's why they are not able to focus, and they are inattentive. So these could be one of the reason. The functional connectivity is lacking in the frontal region for ADHD children. And we all are aware of the various EEG frequency bands. Still, I will touch upon that. Delta waves are zero point 0.5 to 4 hertz. Predominantly, we will have delta during the deep sleep condition, and theta waves will appear in the light sleep, or in the or when we are in meditation or in deep relaxation. And alpha waves will be present when we are awake and in the eyes closed condition. And beta waves are predominant when we are active, alert, and when we focus on a mental task. And gamma waves will occur when we are participating in complex cognitive process. So generally the gamma wave amplitude will be less. So we will not have much amplitude in the gamma waves. So all delta, theta are low frequency waves, and alpha and beta are slightly higher frequencies. So we will see now what will be the difference for a normal person and ADHD subject. What will be the variation in these particular frequency bands? So if you consider the delta frequency, which is the very low frequency, and for normal person, because during the awake condition, delta generally will be very low, because delta will occur only in deep sleep, and it will be found only in infants. Whereas in ADHD children, it is found delta power is very high, especially in the frontal regions. And similarly, theta is also high in case of ADHD, whereas in normal persons, it will be moderate. So Theta is also high in ADHD. That is why the children are inattentive. Next, we have theta beta ratio. That is, it is a ratio of theta power to the beta power. So generally, when you are mentally or when you are having a good focus, you will have a high level of beta. So this theta by beta ratio, beta is in the denominator. So when beta is high, this ratio will be low. So for a normal person, you will have a lower theta beta ratio. Whereas in ADHD, the beta level is low. So when you compute theta by beta, since beta is in the denominator and the beta amplitude is low, this ratio becomes higher. So this is a very important biomarker for ADHD. And then we have alpha wave. We know that alpha wave will be present in the relaxed condition. So in a normal person, we'll have alpha during a relaxed condition, whereas in ADHD, you will find that the alpha power will be less. That's why these children, they cannot relax. So they are hyperactive. And beta wave, which is 12 to 30 hertz, during cognitive task, beta will be high for a normal person, whereas ADHD, since they are unable to focus and their cognitive mental activity will also be less. So because of that, the beta power is less. So that's why they are unable to focus. So that's why they have this inattention. So clinically, how these neurodevelopmental disorders are being assessed by the clinicians, they actually see the DSM-5. DSM is the Diagnostic and Statistical Manual of Mental Disorders. So DSM-5, there is a classification. So clinicians will assess uh, these children with the DSM-5, which is a questionnaire, and based on that, they will grade the cognitive impairments. So, when coming to the scientific way of diagnosing ADHD, in the literature, they have actually researched many methods. And here, this pie chart actually shows what are the various modalities they have used and what is the percentage of these studies that have been carried out. So if you see most of the studies, 39% of the studies for diagnosing ADHD, for assessing ADHD, they have used MRI images. So they have used either MRI or fMRI to detect the ADHD subjects. And the next highly used method is 25% they have used the physiological signals. When we are saying physiological signals, it is the EEG signal which is predominantly used, and very less works are there in ECG signal. And then 6% of the works they have been carried out using the questionnaire method, which is a subjective method. And then 4% of the literature says that 4% of the research works have been done based on the activity. Certain activities are given to the ADHD children and the performance is being assessed, evaluated. That is how much time they take to complete the task. So for a normal subject, the time taken will be less, whereas for a ADHD child, the time taken to complete the particular game will be high. So they generally give a particular activity and they try to measure the time taken to complete the game. So that will be one of the indication of assessing the ADHD. So 4% of the works are based on this activity-based and performance test-based studies, and 4% of the works are carried out based on the motion, by detecting their motion, because they'll be hyperactive. So by having IMU sensors, motion sensors, we can find out we can track their activity, and based on that, we can grade them as normal and ADHD. And miscellaneous, we have other 10%. Then 4% of the studies they have done with the multimodal. Multimodal means it will be multiple modalities like If you take images, they have taken multiple modalities like MRI, fMRI. In signals also, they would have taken EEG, ECG. So more than one modality of the signal has been used for the assessment of ADHD. So we are all familiar with the 1020 electrode system for the placement of electrodes. So since in the case studies we'll be dealing with the placement of electrodes, I just wanted to show the slide. So here this is a 1020 electrode standard electrode system where 21 electrodes are placed on the different lobes. So here we have the prefrontal cortex. So these are named based upon the positions of the lobes. So this is prefrontal, and then we have the frontal lobe, central, parietal, occipital, and then we have the temporal. So on the left side of the hemisphere, if you observe, these electrodes are numbered odd. Odd numbers are given to the electrode positions on the left side of the hemisphere. And if you look at the right side, they are numbered even. And A1 and A2 are the reference electrodes. Generally, the year is taken as the reference. So nowadays, we have sophisticated EEG acquisition systems. So we have wired system as well as wireless system. Portable systems are now available. And even in whether it is wired or wireless, we have different channels. Maybe starting from 8 channel, we have 20 channel system. Then we have 32 channel, 64 channel, 128 channel. So as the number of channel increases, the cost of the equipment is also high. And if you see, we can either go for a wet electrode where the gold cup electrodes are used, or we can go for a dry electrode. Since now EEG standard caps are available, it will come with the pre-marked electrode position. So straight away we have to place the electrodes on the designated locations. So mostly, if you see the research, mostly they'll be using EEG because if you see the advantages of EEG when compared to the imaging method, it is a non-invasive method, and EEG systems are inexpensive, and also they are portable and easy to acquire, and even it is convenient for the patients. And we can also, it is not environment specific, it can be used in any kind of diverse environment. And now commercially, many sophisticated systems are available with standard EEG along with event related potentials with SSVP systems. So with those sophisticated systems, we can do a lot of research. But when you consider the disadvantages of the EEG signal, it is highly non-stationary. Uh, I hope you understand what is meant by non-stationary and stationary signals. Stationary signals means the statistics of the signal will not vary with respect to time. Whereas non-stationary signals, the statistics of the signal, that is the mean variance, skewness, or the kurtosis, all the statistics and also the frequencies will vary with respect to time. So that's why when you process EEG signal, we generally segment the EEG signal into small windows, and then the processing will be done only for that small segment, because we actually convert the non-stationary signal into stationary by segmenting the EEG signal into small segments, so that within the segment we assume that the signal is stationary. And also EEG has poor signal to noise ratio, because easily it is subjected to artifacts, noises. So the SNR is very low in case of EEG. So the methodology that is followed here for any kind of signal processing, these are the standard methodology. So for ADHD detection, generally the EEG signals will be acquired from the scalp, and then the signals are pre-processed, because we know that the EEG signals are having noises. So we have to eliminate the noises using the pre-processing techniques. Once it is noise free, then it will be subjected to feature extraction. So we have many feature extraction methods, so by which we can extract the discriminant features, uh, which will be very significant for the classification. So, so anyhow, we will not be knowing which are the features are discriminant. So we will try to extract. Generally, we try based on the literature. We try to extract n number of features which will be responsible. But if you give all those features to the classifier, because of the redundancy in the features, the performance of the classifier will go down. So generally, if there are large number of features, you will employ feature selection, which will select the most discriminant features. And only these discriminant features, when it is fed to the classifier, the performance of the classifier will be very high. So here we are going to find out or classify between the two classes, normal and ADHD. So we will follow these methodologies to classify between the normal subject and the ADHD. So first step is the pre-processing of the EEG signal. So if you consider the noises that are present in the EEG signal, you can find out the motion artifacts. So during acquisition, if there is any movement in the subject, since we are actually acquiring signals from the children, so motion artifacts will be present and it will reflect as baseline wandering in the signal. Then we'll have the power line interference, which is the 50 hertz noise, and then the high frequency noises. If there are any electromagnetic interferences, so that will reflect as high frequency noises in the signal. And then apart from all this, you will have even the physiological noises, such as even the physiological signals are considered here as noise because the desired signal is EEG. So along with the EEG, if you get other physiological signals, they are also considered as noise. So electroocculogram signal, if you get any electromyogram signal and ECG, so they are also considered as noises. So what are the different techniques that we can employ to filter these noises? The simple method is time domain filtering. So generally, this time domain filtering method will be used for during real-time applications where the computation time is a factor, where you need less computation time. So the moving average filter, I think you would have all studied in signal processing. So it is nothing but the averaging of the previous samples. So if you take the current sample, maybe the filter equation can be the sum of the current sample and the past two samples. So average of the current sample and the past two samples can be taken, and the current sample will be replaced by the average value. So such kind of computation will be done for every, you have to just slide the window and do the computation. So that is why it is known as moving average. Slide the window, and for at every sample point, you take the previous two samples, take the average value and replace the amplitude, signal amplitude of the current sample. So by this way, we'll be able to filter the noise. And the second step is by synchronized averaging. It is nothing but averaging the signal. So you take multiple trials of the signal and then just you take the mean of the entire signal, averaging of the entire signal. And why it is called as synchronized averaging? When you perform synchronized averaging, these trials should be time synchronized. That is, for example, if you're considering, say, if you're giving a stimulus, after the onset of the stimulus will be the marker. After the onset of stimulus, say you're taking 3 seconds of the signal, that is the first trial. And second trial will also be, your 0 will be the onset of stimulus, then you'll be taking for the 3 second. So all these trials should be time synchronized. Then only you can do the averaging. So when you do the averaging, what happens? You know, the noises are random. So when you do averaging, the signal will get averaged, and the noises will, when you average these random noises, will become zero when you do the averaging, and you can eliminate the noises and get the signal. Next is frequency domain filtering, because if you know the frequency of the noises, we can easily use filters to remove the noises. So in the case of EEG, if you have high frequency noises due to the EMG signal or the electromagnetic interferences, we can use a Butterworth low pass filter with a cutoff frequency of 40 hertz. We can eliminate, or we can even use an FIR filter where the cutoff frequency is 40 hertz. Why we have chosen the cutoff frequency as 40 hertz? Because we'll not be analyzing the EEG signal beyond 40 hertz, because beta itself is, upper beta is 30 hertz, and above theta, above 30 hertz, it is gamma. So the optimal higher cutoff frequency can be considered as 40 hertz. So when we have a low pass filter, when we pass the EEG signal through a low pass filter with a cutoff frequency of 40 hertz, the high frequency noises can be eliminated. To eliminate the low frequency noise, which is the baseline wandering, these baseline wandering are the low frequency effects. So you can use a high pass filter with a cutoff frequency of 0.5 hertz, so that the low frequency noises can be eliminated. And we very well know that power line interference is a 50 hertz signal, so we can use a notch filter to eliminate that. So here it is shown. You can even use employ FIR filters. So to eliminate baseline wandering, a high pass filter is used with a cutoff frequency of 0.5 hertz. So you pass the EEG signal. So the mathematical operation that is happening here is the convolution of X of n with H of n. That will be your filtered signal. Similarly, for the notch filter, you design the notch filter with a cutoff frequency of 50 hertz. Then the convolution of X of n with H of n is going to give your filtered signal. And similarly, for the high frequency noises, muscular noise and EMI interferences, you choose the cutoff frequency. It could be 40 hertz or 100 hertz based upon the application, so that you get the filtered signal. Then we have adaptive filtering. And why we go for adaptive filtering? If we are able to remove all the noises in frequency domain itself. So we can use only these frequency domain filterings only when the frequency of the signal and the noise are independent. If there is an overlap in the frequency, if you have noises in the desired signal frequency range, this frequency domain filters cannot eliminate these noises. So that's why we are going for adaptive filtering. So when we have noises in the desired signal frequency ranges, we cannot use frequency domain filters to eliminate the noise. Because when you use frequency domain filters to eliminate those noises, along with the signal, the noise will also get eliminated. Along with the noise, the signal will also get eliminated. So we employ adaptive filtering, wherein in the adaptive filtering, the difference between a normal filter, a linear filter, and adaptive filter is that for a normal filter, the coefficients will be fixed. The filter coefficients will be fixed. Whereas here in adaptive filters, the filter coefficients adapt according to the noise characteristics. But here in adaptive filters, the signals to the filter, you have to give a reference signal. Say suppose here we have taken EEG signal, which is corrupted by EOG, electrooclogram, ECG, and the power line interference. So this is our input. Along with the EEG, we have all these noises. So to eliminate using adaptive filtering, we have to take the reference. So we know that power line interference is present. So power line interference is taken as the reference and it is given to the filter. So the filter is adaptive and the coefficients will be optimized. And so this Y1 of n will be the estimate of the power line interference. Then these two can be subtracted so that you get the residual signal, which is free of power line interference. This residual signal, the input for the second stage of adaptive filter. Say, suppose if we wanted to remove ECG, we can give the ECG as a reference. For the same subject, you have to take ECG signal, so you can use the upper limbs to acquire the ECG. And this can be fed to the adaptive filter as a reference. And your input is now EEG, EOG, and ECG. So again, it will estimate the ECG signal, and once estimated, the residual signal, and the estimated signal will get subtracted, so that your input to the next stage will be free from ECG. And then we have EOG. Again, you have to take the reference signal from the same subject, pass it on to the filter so that you can estimate the EOG noise. And finally, we will get the noise-free EEG signal. So this is also one of the methods of eliminating the noises. So very popularly, we use independent component analysis, which is a blind source separation technique, because we don't know what are the noises that are present in the EEG signal. But we know that EEG signal is a mixture of the brain activity as well as the artifacts. So it is a mixture of the desired signal and the various noises are present. So using independent component analysis, you can separate all these components because all these components are independent. So it is a mixture of signal. So we can decompose these mixtures into statistically independent components. So why we are able to decompose these mixtures into statistically independent components? Because these signals are from different sources. If you take the desired signal EEG is from the brain activity, then the sources of EOG, then other noises, the sources are different. So all these signals are statistically, they are independent. But when we observe the signal, it is a linear combination of all these signals, of all these sources. We observe it as a mixed signal. So the observed signal or the acquired signal is a mixed signal. So when you apply this ICA, independent component analysis, so as an output, we will get these all the independent components. So along with the signal gets separated. So along with the signal, even the noise components will also be present. So at the output of ICA, you will have the independent components, and also it will give the mixing matrix. How these independent components would uh, have been mixed to get the mixed signal or the observed signal. So the EEG signal will be present in the independent components. So among the independent components, you have to identify which is the desired EEG signal and which are the noises. So you can employ, or you can find out the spectrum of all the independent components. And from the spectrum, you can easily identify the signals and the noise, and you can eliminate all the noises. And from the independent component, you can reconstruct the EEG signal. So most of the research papers, they use independent component analysis. So the next, in the methodology, the next step is after eliminating the noises, we have to extract the discriminant features. So I have taken all the features that have been given in the literature. So they say univariate EEG features. So what is meant by univariate here is you have number of channels in the EEG acquisition. When you acquire, you take signals, EEG signals from different channels. So when I take univariate EEG features, these EEG features are extracted from every channel, when you employ feature extraction from every single channel, then it is called as univariate EEG features. So we have time domain features, that is from the raw EEG signal. In the time domain itself, we can extract the features such as mean, variance, skewness and kurtosis, and then zero crossing rate. We know mean is amplitude, averaging the amplitude. Variance, it will measure the signal variability. And skewness and kurtosis will give the asymmetry in the signal distribution. and zero crossing rate will give number of times the signal crosses the zero amplitude level. Then in the frequency domain, we have band power features. So we know what are the various different frequency bands are available. So we can extract the delta band power, theta band power, alpha band power, beta band power, and also total band power. By summing all this, we'll have the total band power. Then relative band power, that is, we can have relative theta band power, relative delta band power, that is, relative band power is with respect to total power, we try to measure the relative power. Say, for example, if it is a relative delta band power means delta band power divided by the total band power. Then the other features are theta beta ratio, then power of sensory motor rhythm. Actually, the sensory motor rhythm is a very important biomarker for ADHD. Sensory motor rhythm is nothing but the low beta, which is 12 to 15 hertz. So it is found that SMR will occur when the person is, what is sensory motor rhythm? It is a low beta signal. This will be present when the person is attentive without any motor activity. So you should be attentive, and if you don't have any motor activity, then you will have this sensory motor rhythm. So again, there is a difference between the sensory motor rhythm with respect to normal and ADHD. So to extract the band power, mostly they make use of the Welch method, where the signal is divided into overlapping segments, and for every segment, FFT is applied, and then finally the FFT is averaged, and the band power is measured. Then we have the entropy based features, and entropy based features actually measures the randomness in the signal, the irregularities in the signal. So if you see, there are different entropy measures: Shannon entropy, approximate entropy, and sample entropy. So I have not given the formulas and all, so you can later on, if you want to employ these methods, you can go for a detailed study. And then we have a nonlinear features, fractal dimension, Lipinov exponent, and Hurst exponent, which are the nonlinear features that are being measured from the EEG signal. So fractal dimension quantifies the signal complexity and the roughness, and Lipinov exponent measures the signal sensitivity, and Hurst exponent measures the signal persistence or anti-persistence. Similarly, we have amplitude and phase features can also be measured from the EEG signal. So for that, they use Hilbert transform to measure the amplitude features and phase features. And also from the phase, we can also measure phase amplitude coupling. That is, a relationship between the phase and the amplitude of different frequency bands can also be measured. Then another set of feature is the wavelet transform features. We can also decompose the EEG signal using wavelet transform into different frequency subbands. And from the subbands, we can measure different features. So here, generally, they will measure energy and entropy in the wavelet domain. So from the wavelet coefficients, the summation of the squared coefficients will be the energy. So energy is one of the feature that is used extracted from the wavelet domain. Then they have also measured multivariate EEG features. So as I told you, univariate there represents features taken from every single channel, EEG channel. Here multivariate EEG features, they analyze multiple EEG channels for extracting the features. That is, they find the relationship between different channels. So that will give the interaction between the different channels, which generally we say that it is a functional connectivity. So as I told you, there is every brain will have functional connectivity. Between different lobes, there will be connectivity. So this functional connectivity can also be measured. Connectivity cannot be measured from a single channel, because it is connectivity between different regions of the brain. So that you need to take multiple signals from different channels and then measure the functional connectivity, which will give you the relationship between the various channels. So different metrics are being used, like cross correlation to measure the similarity between the two channels, and coherence is measured, which measures the phase consistency between the two signals. Then phase locking value is also being measured, which gives the phase synchronization. It assesses the phase synchronization between the signals. So one typical example I have shown for functional connectivity, how these channels are functionally connected. So here we have 125 channels. This particular example is shown for 125 channels. So if you take one single row here, on the top one row, if you take, these are the correlation coefficients uh, comparing two channels. So if you take here, the first channel will be correlated with the second channel. First channel can be correlated with the third channel. First channel can be correlated with the fourth channel. So the correlation coefficient is measured between the channels and its value varies between -1 to +1. And then it is normalized to vary between, if you find out correlation coefficient, it will vary between -1 to +1. Then they have normalized those correlation coefficient values to 0 to 1. And a color mapping is given so that all these coefficients are now color mapped, and it is shown the entire 125 cross 125. Every channel is mapped, or connectivity of every channel with the other channels have been done, and it is shown as a color map. But if you see here, the upper diagonal and lower diagonal will be similar, because one, when you compare one with the second channel and two with the first channel, both are same, is it not? So if you see, both the upper diagonal and lower diagonal will be similar. So either we can take lower diagonal or upper diagonal for further processing. So functional connectivity is also considered as a biomarker for ADHD. The next biomarker is the event-related potential, which is P300. So as I told you earlier, when a stimulus is given, the latency is measured. So it could be, the stimulus could be an audio stimulus or video stimulus. After the onset of stimulus, after 300 millisecond after the onset of stimulus, you will find a positive peak. So here it is positive only, though it is shown in the negative side. But here you can see +3. So below the baseline it is positive, and above the baseline here it is shown as negative. So 0, if 0 is the onset of stimulus, so you can see there is a positive peak here. So this time gap is called as a latency. So P300 means after 300 millisecond, you will get after a latency of 300 millisecond, you will see that there is a peak. So for ADHD patients, it is found that this P300 is longer. So generally, even for normal subjects, it will not be exactly 300 millisecond. It will vary between 250 to 350. But for ADHD subjects, it is found that this latency is still longer. So we can measure this event-related potential also could be taken as one of the feature to classify a normal and ADHD. So generally, this P300 will elicit only for a rare event. So here is an example where audio stimulus is given. So what is shown is a red is a tone of a particular frequency, which is very frequent. Frequently, they will give this particular frequency. And the blue is infrequent stimulus. So whenever we hear the frequent stimulus, and suddenly when we hear an infrequent audio stimulus, that will be the that will elicit P300. So that is what this paradigm, we call it as an oddball paradigm. So when you frequent stimulus should be given, and suddenly they should be surprised by a sudden stimulus of infrequent stimuli. So this P300 will elicit. So here you can see 0 is the onset of stimulus. And you can see the red ones are non-target stimulus. Without any target, we have measured the EEG. And blue one is with the target, the EEG signal is measured. So you can see after the onset of stimulus, which is at 0, and after 300 millisecond, you can see a positive peak. So this time latency can be measured, and that can be taken as one of the feature to distinguish between AD normal and ADHD, or to classify the subtypes of ADHD. So I will take a few case studies to see how these features are employed to classify the normal and ADHD. So here is a study where they have used both univariate and multivariate features. Nonlinear features have been used. So in this study, 24 children, 12 children are ADHD and 12 are normal. 24 children have been taken and their EEG have been measured. So EEG signal from 19 channels have been measured when the children were in the resting state and eyes closed condition and resting state. And the sampling frequency of the EEG was 256 hertz and 16-bit A to D converter was used. And this is the methodology they followed from 24 subjects and 19 channels. And they have used both the Butterworth filter to filter the noise 0.5 to 60 hertz, and then a notch filter to eliminate the power line interference. Then they have gone for both univariate and multivariate features. So univariate features, I told you it is the features that is extracted from the single channel. So both they have gone for linear and non-linear features. And for multivariate, when they compare with the different channels, they have taken non-linear features. So linear features, they have taken average power and total band power. And non-linear, they have taken Shannon entropy, sample entropy, and this is dispersion entropy. And MSE is multivariate sample entropy. And non-linear features, they have taken multivariate sample entropy and multivariate multi-scale sample entropy. And finally, they have used machine learning classifiers, ML classifiers to classify. So they compared the performance with the MVSE, that is multivariate sample entropy feature vector, as well as the combined feature vector they have taken. And on an average, they have got around 8% of classification accuracy. So let us not bother about why the classification accuracy is low and all that. So what I wanted to emphasize here is what is the methodology that is followed in the diagnosis of ADHD, so that when you do research, you can try to use such methodologies. So this is another paper where they have combined both time and frequency features. So if you see the feature extraction part, for here they have taken morphological features. Here the mean morphological features are nothing but the event related potential. So here they are giving auditory stimulus and measuring the P300. So here as a morphological features, they are taking latency, the amplitude, as well as the latency by amplitude ratio of the P300 wave. Latency, the time taken between the stimulus and the response, and the amplitude of the P300 wave. I showed you a positive peak after 300 milliseconds. So here they are taking the amplitude of the P300 wave, and then the ratio of these two, latency and by amplitude ratio, is taken as a morphological feature. And for the nonlinear feature, they have taken the fractal dimension. And for wavelet features, they have taken the event-related potential and decomposed using wavelet transform. From different frequency bands, they have taken the entropy wave, and they have computed the entropy values from the wavelet coefficients. So they have used ERP, that is, they have decomposed the event-related potential into 3 levels. And from the subbands, they have extracted the entropy. So this entropy is calculated from the wavelet coefficients of the event-related potential. So all these features are then they are doing feature selection so that only discriminant features are fed to different algorithms, different classifiers. So, and they have compared the performance of different classification methods. So these are the classification accuracies. And the next method, they have used deep learning networks. Here, they have gone for a different method, like they have extracted EEG feature maps, and then they have used deep learning method. So here, if you see for feature extraction, they have taken the time features, the time domain features, Hijorth activity, Hijorth mobility, and Hijorth complexity, then peak-to-peak values, skewness, and kurtosis in the time domain. And they have taken 6 nonlinear features, that is Lipinow exponent, correlation dimension, fractal dimension. Fractal dimension, they have taken from different methods, Higuchi method, Katz's method, and Hurst. Then Hurst exponent and approximate entropy. So here, if you see, they have taken 6 time domain features and 6 nonlinear features. So totally, they have taken 12 features. And all these extracted features, they have been mapped into a 2-dimensional topographical feature map. So which is called as the EEG feature map. So we will see how it is being done. So this study has been carried out for 15 ADHD subjects and 18 controls. So EEG data is recorded from 30 channels, 30 different channels for 4 minutes and segmented into 5-second duration. So for every subject, that is, if there are 15 ADHD subjects, for every subject, EEG data is recorded for 4 minutes. From all the 30 channels, the recording is being done. So as I told you, EEG signal is of nonlinear nature. You cannot take the entire 4-minute signal and then you cannot process it. So this EEG signal has to be segmented into small segments and then analyzed. So they are being segmented into 5-second duration. So every person has 4 minutes of EEG data, and now they are being segmented into 5-second duration. So for a single subject, so 4 minutes means 4 into 60. So it will be 240 seconds. 240 second divided by 5 second, how many segments we will get? Around 48 segments, is it not? So for every subject, we'll get 48 segments. And based on these, for every segment, we are going to extract all these 12 features. And all these 12 features are now, we will map into the topographical map and form the EEG feature map. So this EEG feature map will be created for every single feature. So if you see the 1020 electrode system here, here they have used 30 channels, and these are the specific channels from which they have acquired the EEG. So totally there are 30 channels. Now we'll see how it is being mapped, how these feature values can be mapped here. So here generally they are taking a 9x9 matrix. A 9x9 matrix is taken. So if you take a 9x9 matrix, totally we can have 81 values in a 9x9 matrix. So up to 81 channels can be mapped into a, so you can even go up to 81 channel, and that can be those information can be mapped into the feature map. So here you can see on the left side, we have the topographical map. On the right side, you have the feature matrix, EEG feature matrix. So every point here is designated with a particular electrode location. So why certain locations are not shown in red? Because those locations have not been used by the researcher. So whatever locations he has used, Those are being marked in red here. So now these locations will carry the feature values. Say if I'm creating this feature matrix for a particular feature, for example, say entropy feature, then FP1 location will have so all these locations now will have the entropy feature values. So I can create a EEG feature map only for entropy. I can create EEG feature map only for band power. So for every feature, we can create this feature map. So once these features are computed, these features I told you, all these features, once they are computed, they are normalized between their values, are normalized in a scale of 0 to 1. So if you see here in these feature maps, the values have been scaled to 0 to 1. And when their feature values are normalized between 0 to 1, they can be easily mapped. So color mapping is being done for a range of 0 to 1. So we have to extract the features, and then we have to normalize the feature values to between 0 to 1, and then give a color mapping, color scale for that. So minimum feature value, which is 0, will take the blue color, and the maximum value will take the red color. So the signal strength easily you can analyze using the colors. So why we need to have this EEG feature map? Why we have to form this EEG feature map? Why can't we give the feature values directly to the classifier? Because here we are going to use deep learning networks. Say if convolution neural network is being used in this work. So for convolution neural network, images have to be fed to the 2D convolution neural network. That's why the feature data is being converted into a 2D color map, 2D color image. So, but if you see only the matrix has values only at the selected points. But what about in between? Because in between I cannot have 0, is it not? So they have interpolated. So based upon the neighboring intensities or neighboring feature values, this value, the missed value is being interpolated. Generally in image processing, we'll be doing that. Based on the neighboring pixels, we try to estimate the pixel. So similarly, here the missing pixels or missing values, feature values are being interpolated from the neighboring feature values. So that's why you have a continuous map here. So that in this way, for every feature, this map will be created. So all these 48 segments into 12. So for every subject, you will have 48 segments into 12 maps. Since you have 12 features, 48 into 12 color maps will be there for every subject. So they are pooling all that, and then it is given to the classifier. So if you see, every feature color EEG feature map is fed to the convolution neural network. So here you can see the independent features, color maps, Hurst entropy, and the fractal dimensions, Lipinov exponent. All these feature maps are given independently to the CNN. So here you have a series of CNNs. So here deep feature extraction, it's nothing but the deep learning model we have. So here we have the convolution neural network. So every convolution neural network extracts deep features from this, and then the output of these CNN will be the features. So these features, because you have high number of features, they have taken almost 1,000 features, and then from independently these features are reduced by feature selection method, so that highly discriminant features are being selected, and then finally all fused to form the feature vector. This feature vector is given to a machine learning algorithm to finally classify. So here the deep learning network is used to extract the deep features from the color maps, and feature selection is used to find the discriminant features. And finally, the feature is fused because you have to fuse the features taken from different features. So finally, they are all fused to form a single feature vector, and then you can go for a classification. So here the authors have compared the performance of the algorithms, and and they have shown that their methods are superior. They have a higher classification accuracy. So till this, we have seen about certain methodologies, how ADHD is detected. So most of the literature, they have not gone into various grading of ADHD or mild or severe ADHD. So most of the works are focused on differentiating between normal and ADHD. But what is required is you can use the same methodology, whatever we have seen. We can use the same methodology, but we have to grade the ADHDs into mild. Uh, we have to have grading in ADHD that will be add a value to the research. So now, as a therapeutic tool, we are going to see how neurofeedback can be used for the ADHD subjects. So, what is neurofeedback? We are going to self regulate our own brain activity. One's own brain activity can be self regulated. So, when we self regulate our own brain activity by altering the neural mechanisms, it enhances the cognition and behavior. So, this kind of enhancement can be done for both healthy subjects as well as for the subjects who are affected by neurodevelopmental disorders. So, it is used as a therapeutic tool. And why neurofeedback is popular is that the advantages of neurofeedback is that it is non invasive and there is no side effect, and long term regulation is possible. And why through neurofeedback, why we are able to succeed, it is because of the neuroplasticity. So our brain is adaptive, it can learn. So the neuroplasticity is one of the advantage. By regulating our own brain activity, we can enhance the neuroplasticity and positive reinforcement. This kind of training will provide positive reinforcement, which will in turn help in neuro rehabilitation. So that is what throughout our life there is a possibility of neuroplasticity, but the neuroplasticity will have very good effect in the young age. That's why early detection is very important. We have to catch the children at the young age so that we can give such kind of therapeutic tools so that through neuroplasticity they are able to regulate their own brain activity. Then operant conditioning is one strategy that is used in neurofeedback. That is, positive reinforcement will be used. So whenever they perform well, you have to give some reward. So whenever these children perform the activity well, you have to reward them by giving some points, showing some say what to say, some rewards on the screen. So in that way, they get motivated to do the task. One second. So if you see the applications of neurofeedback, so it is not only used for ADHD, neurofeedback can be used for autism, can be used to treat stroke, epilepsy, chronic pain, mental disorders, and even for high performance training for sports personnel if they wanted to enhance the performance in any profession for that matter. If you want to enhance the cognitive performance, neurofeedback can be used, and for tinnitus also. So what we are trying to do in this neurofeedback is that, say for example, we know what is delta brainwave. This it is found that delta waves are found to be excess in or very high in ADHD children or in a person with a learning disability. So we have to, through neurofeedback, we have to reduce this delta waves so that we can treat the ADHD children. So excess of delta waves is found in ADHD. So we have to, through neurofeedback, we have to reduce the delta. And again, theta is also found to be very high in ADHD. And generally, excess theta in the left hemisphere. So we have both left and right hemisphere. So if you have excess theta in the left hemisphere, that is due to the lack of organization. So excess theta in the left hemisphere results in lack of organization, and excess theta on the right hemisphere results in impulsivity. So it is very important to measure theta in different locations also. And theta in people with attention disorders, it is found to be high in the frontal lobe. Theta power is found to be high in the frontal lobe. And if you take alpha, we know alpha condition, you will get alpha when during the relaxed condition. But it is found that if you have low alpha in the right hemisphere, it is correlated with negative behaviors. And negative behaviors such as social withdrawal, and also in people with depression. So when the brain is healthy and when it is well regulated, you will have more alpha on the right side of the hemisphere than on the left side. So when you have more alpha on the right side, it is a positive behavior. And if you have low alpha in the right side, it leads to negative behavior. So generally, neurofeedback, we go for alpha training. We mostly use alpha training. So this kind of alpha training, that is, we use neurofeedback to increase the alpha level. So alpha training is used to treat diseases such as pain relief, reduce stress and anxiety, to improve the memory and improve the mental performance and treatment of brain injuries. And if you take beta, as I told you, low beta and sensory motor rhythm, beta is generally found when we are alert. So continuous high frequency, I told you when beta is less, that means they are inattentive. But there is a problem if they have high beta also, continuous high beta is also a problem. Because if continuous high beta is present, they'll have difficulty in relaxing. So even at night, it will be difficult for them to fall asleep if you have high beta waves. And gamma waves, we know they are going to present only in the high cognitive functions. So that will not be relevant here in ADHD. So this is how a neurofeedback system is designed. So EEG signal is acquired. The signals are pre-processed. So till this, it is the same what we have discussed. You can extract the features. Here, mostly in neurofeedback, we extract band power because we are going to regulate only the EEG frequency bands. So whatever methodology or whatever protocol we are going to choose, based on that, the band power will be, features will be extracted. And this band power will be given as feedback to the subject. So it is a closed loop. So what we have seen till now as a diagnosis is an open loop, and here it's a closed loop. So through the stimuli also we can give neurofeedback. We can employ audio stimulus, visual stimulus, or even game can be used as a stimulus. So this neurofeedback will be given. So the person will know what will be the levels of theta, alpha, that will be shown to him as a bar. So that amount of alpha and amount of beta will be indicated to the person so that he can visually see what is his alpha power. He can visually see what is his theta power. So based on that, he can do the training. So he is regulating, the person is regulating his own brain waves in order to correct or get the optimized performance. So the types of stimulus that are being used are audio stimulus. So you can give audio only when the feature, say for example, if you do alpha training, only when the alpha power exceeds the threshold, you can give the subject the audio stimulus. So you can ask the person to sit in the relaxed state with the eyes closed. So when the person is sitting, when the child is sitting with the eyes closed condition and under the relaxed condition, and now we are acquiring the EEG signal continuously. So the child will not know what is the alpha power. So whenever the alpha power of the child exceeds a threshold, we have to give some stimulus, audio stimulus. So whenever audio stimulus is given, the child will know that her alpha or his alpha is above the threshold value. So the such kind of feedback can be given through the audio stimulus. And video stimulus is that like taking off an aeroplane, blooming of a flower, all these things can be given as their own brainwave signals can stimulate these activities so that they will know whenever there is a takeoff of an aeroplane, they know that their band power is well above the threshold. If it is less, that activity is not going to take place. So this is a kind of feedback based on the visual stimulus. Similarly, a game stimulus can also be given. So here you can see the Pac-Man game. The Pac-Man can move based upon the EEG band power of the subject. So we can choose different neurofeedback protocols based upon what we wanted to enhance and what band we wanted to inhibit. So here you have alpha by theta protocol. That means we are going to increase the alpha power, and at the same time, simultaneously, we are going to reduce the theta power. So this kind of alpha theta protocol will be useful in treating stress, deep levels of depression and addiction, and also to treat ADHD in children. Similarly, delta protocol, it is lowering the frequency of delta waves because their delta frequency power will be high. So when we use delta protocol, we have to lower delta wave. So this kind of delta protocol is also used to alleviate headaches, traumatic brain injuries. Then we have beta protocol. Beta protocol, we generally know we will try to increase the beta band power in the beta protocol so that we will enhance the cognitive performance. So that when we use beta protocol, they'll be able to improve their attention, focus, and cognitive performance. Then we have the sensory motor rhythm protocol, which is a low beta. So again, when we try to increase this low beta SMR, again, we'll be able to improve the focus, attention, and reduce the symptom of hyperactivity. So apart from this, there are other protocols also, beta by SMR, alpha by theta, theta by beta. So all these protocols have to be selected so that it should be customized and it should be given as a personalized treatment to the children. So in a topographical map, you can see before treatment and after treatment what has happened. So before treatment, their beta levels is found to be high, very high. That means they have, they are hyperactive. They could not take rest, or there is restlessness, impulsivity, and hyperactivity. So after treatment, so that means before treatment, you have to find out, extract the band powers, and these band powers are mapped into topographical map as a color map. So this gives delta band power, theta band power, alpha band power. So before treatment, before neurofeedback, we have to assess what kind of protocol has to be used. So here, if you see, their beta values are found to be very high. So that means they are hyperactive, and you have to choose beta protocol and provide neurofeedback to those children. So when you give neurofeedback, here you can see after treatment, their beta levels, very high beta levels have been reduced. So again, after treatment, you have to assess and extract the band power and see what are the changes that has happened. So here I will show a video. So this graph shows in the prefrontal channel, the theta level, how it has been reduced with the neurofeedback. So this is blue is without neurofeedback, and this is with neurofeedback. How we are able to reduce the theta level as well as increase the alpha level. So you can see here, alpha level is low in FP2, blue is alpha, that is without neurofeedback. And after neurofeedback, it has been increased. The alpha power has been increased. So here, these are the various training. Here you can see different subbands you can choose, and based on that you choose the threshold here. So here is a bar chart which shows the power value, and you can fix the threshold, and in real time you can acquire the signal, and this signal, this kind of feedback can be shown to the subject, so that whenever the power rises above the threshold, some kind of stimulus, audio stimulus or video stimulus can be given to the subject in order to motivate them to sustain the particular condition. So, and lastly, I will show one video where we have implemented this. You're able to see the video?
Yes, madam. Yes, madam. Yes.
So here we have used only frontal lobe, FP1 and FP2. So this kicking of a ball takes place based upon the frontal band power. So for EEG is acquired in real time, and based on the frontal alpha band power, this kind of activity is being carried out. This is the rising of the. So here on the left side, you can see the band power. So rising of a sun or a setting of a sun can be done based on the neurofeedback. So neurofeedback can be considered as a therapeutic tool, not only for ADHD, but for several conditions. This neurofeedback can be used as a tool, so which is a non-invasive method. So generally, these ADHD children, when they take a lot of medications, there are a lot of side effects, and they generally go for occupational therapy, which is a very long-term process. So this neurofeedback can be a successful method for which we can use neurofeedback as a therapeutic tool for the ADHD children. So with this, I complete my presentation. So if there are any questions, I can take up the questions.
Madam, I have a question, madam. Just
Yes, sir.
Okay, madam, in previous topic you told them for deep learning, you take the 1 minute EEG, we segmented 10 seconds, suppose. You take some of the features, entropy features. But whenever I take the 10-second epoch entropy feature, I get only one value or array of a value, madam.
No, that's what you mean. No. Generally, when we take EEG signal, for example, I'm taking 2 minutes EEG.
Okay.
So generally, will not take 2 minute EEG. Entire 2 minutes EEG should not be used for processing.
Yes.
So we have to segment the 2 minute EEG signal at least for 3 seconds. We have to take every segment 3-second segment in that entire 2 minute duration.
Okay, but
and then all these features.
Every 3 seconds I get the one value or single value, or each 1 second I got one value within three seconds.
No, that 3 second can be taken as the entire segment. You need
Entire
not go
second,
for every
final
1 second.
entropy. Suppose I take the approximate entropy within that 3 second window. I get single value or any array of the value.
No. What I'm saying is for the entire 3 second, you can take it as a single value.
Single value. Okay.
That you need not actually again take it for every 1 second.
Okay.
What I mean to say is, if I am segmenting, say for example, 3 minutes data, say for example, for easy understanding, 3 minute data, if I am segmenting into 3 seconds, so every 3 second will be one trial of EEG.
Okay.
So for a single subject will have multiple trials.
Okay.
So every trial, I think I have answered. Every trial
Yes.
can be labeled as one data.
Okay. Understood.
I think
Madam, one
someone
more.
has paused one question.
Okay. Madam, one more question. Just
Yes,
final.
yes.
Okay. Madam, any hardened rules that any EEG, this is a minimum epoch size we can take. Any hardened rules?
Epoch in the sense number of trials.
Second number of segment, meaning every second segment I
Every
can.
2 second. Okay. There is no rule actually, but maximum I think we can take till 3 second.
3 second. That is maximum. Every three
Maximum.
second epochs, meaning we consider Windows.
Yes.
Okay. 3 second.
Windows.
Windows. Okay. Thank you, madam. That is.
Some study we can also take overlapping windows
Yeah.
if we
Okay.
assume that there is some loss.
Okay. That is.
Ma'am, I have a doubt, ma'am.
Yes.
While doing the filtering process, noise removal of the EEG in the pre-processing,
Yeah.
whether there will not be any loss in the original signal, and is there any method to verify or justify that, ma'am?
That's what you have to, after filtering, you have to again see the frequency spectrum and see whether the frequency spectrum of the desired signal is retained.
That is before pre-processing and after
Before and
pre-processing.
pre-processing, and after pre-processing, you have to take the spectrum and then you need to compare.
Okay, both the frequency spectrum will be the same.
No, it will not be the same. Before filtering, if you are taking the frequency spectrum, these noises will be there. Say, suppose 50 hertz noise
Yes,
is there. You will find a peak, 50 hertz peak, and even in the harmonics, this peak will be there. Say 50 hertz, there will be a peak, 100 hertz, like that. And if you see other high frequency noises, if you take the spectrum of EEG, if you have higher amplitudes in 100 hertz, in the high frequencies, that is an indication of that high frequency noises are present. So blindly, we should not go for any pre-processing method. That's why we have to analyze the signal. In the frequency domain, we have to analyze the signal to identify what are the typical noises that are present.
Okay. Thank you.
Because
Hello,
pre-processing takes a vital role, because the entire process depends upon the signal quality.
Yes, ma'am.
hello, ma'am.
Yes, sir.
Ma'am, actually, you have taken as feature maps as well as topographical maps.
Yes.
What type of a software tool that can be used for getting those feature maps or topographical maps of brain?
MATLAB software itself can be used.
EEG lab or any
EEG
name?
lab can also be used. Nowadays, we have many softwares which give these kind of maps. But if you want to do, you can do it in MATLAB also, or in EEG lab software.
Okay.
If you understand the concept, you can implement it.
Okay. So by taking those features, we using those loops and implementing in the EEG lab, so that we can get the those pattern of
The color
topographical
maps.
maps.
Yeah.
Okay. Ma'am, one more thing. Whether any online data sources that are available for ADHD?
Yes, it's available. You can find out in papers in literature they have given. EEG dataset is available. But only normal and ADHD is available. There is no classification. Among the ADHD, they have not given any classification.
Multi-classifications or
Multi-class data is not available. But what I find is many literatures, they are saying they are getting so much of accuracy. But if you take the same data and if we work those algorithms, there will be a contradiction.
okay, ma'am. In your experimental
They may not
work,
get the same exact
what
results.
kind of feature may be a predominant role for classification of those kind of ADHDs? Whether it,
For
what
ADHD,
kind of features, either it may be a time domain features or frequency domain features, which one will be a predominant role that plays in classification of those?
okay. The band power, we can take all the band power features of all delta, theta band power, and then relative band power, then SMR band power in the frequency domain, and nonlinear features, fractal dimension, then entropy features are they are discriminant actually.
Okay, ma'am. How many numbers of channels that you have used in your experimental work, ma'am? I think
Numbers
in the
we have
video I
taken
saw that
20
only
channels.
few.
Huh?
Only few channels I saw in the video.
No,
What did you
that is
want
for
to use?
neurofeedback. For neurofeedback, we have
Oh,
taken only 2 channel. But that also you will have a lot of studies are there, which protocol we need to use. Based on that, we have to choose the location of the electrode positions.
okay. What kind of device that you have used in your experimental work, ma'am?
It is a Nexus 4-channel EEG 4-channel acquisition device.
Excess?
Nexus, NEXUS.
Oh, okay.
Nexus wireless EEG 4-channel EEG device.
Okay.
Ma'am,
Okay, ma'am.
during neurofeedback, what kind of training you give? Suppose the alpha power is more, you said you will give an indication like audio's indication or something like that. Now, how do you restore? What kind of a training you provide?
Now, how to decide what kind of training? What is the
Yeah.
question?
Yeah.
How to
What kind
decide
of?
upon the protocol, which protocol to be used? Is this the
Yeah.
question?
Yeah.
Okay. So that's what first we have to assess the child. So that
Yeah.
means in the resting, we have to take the resting state EEG under the eyes closed condition. We have to record the EEG from all the channels.
Yeah.
At least some 15 minutes EEG data we have to record. And then I have shown the band power topographical map where the band power.
Yes, ma'am. Yes.
So this kind of a topographical map we have to form.
Implement. Ma'am, if
So
it
this
is
indicates
alpha
delta
protocol.
band power. For every band power, we should map the topography, and we have to see where in exact which location the power is high, and that
Yeah.
should be correlated with the DSM-5 also. We have
Oh,
to take
DSM
opinion from the clinician also, from the
Okay.
DSM-5, and then you have to use this before applying neurofeedback. You have to form the topographical map and see what kind of protocol, because we have to do only customized treatment plan. We cannot have a universal plan for everyone. You cannot go for a particular protocol. So that should be customized based upon their neural activity.
So if you choose a particular protocol, say alpha, what kind of training is actually given to the child? How do you restore? After feedback, you'll see that this alpha power gets reduced, right?
No, alpha power, we have to increase the alpha power.
Yes, okay, increase. So what kind of training is exactly
That's
done?
what we have to, one method is we can ask the child to sit and we can ask the child to close their eyes and sit in the relaxed state.
Okay.
And
So
then
for
we
different
can acquire the EEG, and then whenever the alpha power is high, that we can give an indication of audio stimulus.
yeah.
So we can give a sound, because the child is sitting with the eyes closed condition.
Yeah.
They will not know what kind of alpha they are producing.
Yes.
So we can give an audio stimulus. The
Oh,
other
if,
one, what I showed, the rising of the sun.
okay,
That
ma'am.
can also be done as a visual
If the
stimulus.
child gets an audio indication, what can be done? What
No,
the
if
child is
child
supposed
gets
to
an
do?
audio indication, it means that the child, they are giving a feedback to the child that
Yeah.
she is doing correctly, and they have to maintain the relaxed position.
Okay, so you need to maintain that state so that no more alarm or no more indication comes. Is it?
No, it's not an alarm. Whenever there is a rise in the alpha power, whenever the alpha power is above the threshold,
Yeah.
this audio will be played. Say, for
Okay.
example, a music will be played. This
Okay.
music is continuously being played when they perform well. When they don't
Okay.
perform well, this music will get stopped.
Oh,
So that is an
this is
indication that they are not performing well.
okay, fine. I understand.
Like
If
that, you
beta,
have
you need to reduce. If beta power, you need to reduce that.
like
Yes.
that we can actually
Okay.
decide all these video stimulus are using our creative thinking. We can actually
Okay, customize.
we can customize the stimulus.
Okay, ma'am. Thank you. Thank you very much. It was an excellent presentation. Thank you.
Thank you so much.
Ma'am, can you please look at chat box?
Yeah.
Madam, the question is how ICA is different from adaptive filter. For adaptive filter and ICA, independent component analyzer, in which domain EEG has to be either time or frequency domain?
No, it is found that among all the methods, what I told you, ICA is superior method. Independent component analysis is a superior method when compared even to the adaptive filter, because even in the adaptive filter, you can see we have to give the reference signal, and again you have to acquire other signals and give it as a reference signal. So for ICA, EEG alone is enough to do ICA. So why I told about the time domain filtering is, in certain cases where real time, when we do some algorithms in real time, this moving average filter will be used so that the computation time will be less.
So if we go for ICA, then is that we don't need to go for adaptive filtering and basic noise filtering as well?
Yes, it is enough if you choose one type of filtering.
Okay.
ICA alone can be used to filter the noises.
Okay. And my second question was, from which domain of the signal nonlinear features can be extracted? Whether your signal has to be in time domain or the frequency domain?
It has to be in the time domain.
Okay. Is that wavelet transform converts the signal into the time frequency domain?
Yes.
Okay. Thank you.
Thank you.
Thank you, madam, for your excellent presentation. You have continued up to 9:40, and your presentation has been extended with so much of questions. Thank you, madam. We have got the enough insights about EEG signal processing for ADHD diagnosis from different perspectives. Thank you very much, madam.
I thank the organizers for giving me this wonderful opportunity.
Madam, my personal thanks also, madam.
I thank all the participants for their interest. Even at this hour, they are very much curious to know. Thank
Yes,
you for your
ma'am.
interest.
Sasikala madam, thank you very much. We got a lot insight about the detailed EEG signal processing over here.
Thank you so much, madam.
And can you please share your contact details?
Yeah, I will now put it in the chat box. You can email me further if you have any clarifications.
Yes, ma'am, please.
Thank you so much. Sir, can I
Thank you,
leave?
madam.
Thank you, madam. Thank you, madam. Yeah,
Thank you. Thank you.
please. Dear participants, thank you. We'll meet tomorrow at 6:30. Thank you.